Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Mr. Speaker, this NDP Premier is the architect of decriminalizing and normalizing the open, public use of illicit drugs like meth, heroin, crack cocaine, and fentanyl. His Friday announcement was nothing more than political damage control and a decrim deception that fails to end this reckless drug policy. Nothing is going to change until he admits that it was a mistake and cancels this disastrous, catastrophic NDP policy. So my question to the Premier, will the Premier scrap this entire decriminalization mess today? And if not, why not?
Mr. Premier.
Thank you, Honourable Speaker. This is a serious issue. We're talking about responding to a toxic drug crisis in this province that's taken thousands of lives and trying to find a path forward that does two things. One is make sure that people stay alive, they get a chance to get into treatment, and the other is make sure that we have safe communities that work for everybody. On Friday, we announced our request to the federal government to amend the certificate to make sure that our communities are safe. People feel comfortable in their communities, that they can go to local businesses, take the bus, go to shops, feel comfortable, that police have the tools they need to address open drug use. But we did leave some specific areas where we hope people take advantage of services where they go without fear of arrest. One is overdose prevention sites, where they can go connect with medical professionals, connect with treatment. The other is drug testing sites, where they can go and test their drugs, make sure they're not going to die, make sure they're not using something you don't understand what it is. And the third is at home. If someone has an overdose, that they can call an ambulance without worrying that there might be criminal consequences for that. We're trying to keep people alive and ensure safe communities, and I hope that on reflection, the Leader of the Opposition understands the importance of people attending overdose prevention sites, of if they're dealing with addiction, of testing their drugs to know what they're using, to minimize that risk of death and serious injury.
Leader of the Official Opposition, supplemental.
Well, thank you, Mr. Speaker. Well, Mr. Speaker, the problem is that for 18 months, we have seen the results of these efforts of yours, Premier. And sadly, in 2023, over 3,500 British Columbians lost their lives, a record number of overdose deaths in British Columbia. So it is not working. And when something's not working, doing more of the same thing generally doesn't drive different results. Now, the Premier's plea for a federal bailout is just a Band-Aid for this self-inflicted policy disaster. His Friday announcement did not end decriminalization, and it will not end the chaos and the carnage on our streets, our hospitals, and throughout every single community. And we know, and British Columbians are concerned, that after an election, God forbid the government find themselves back in power, that they would reverse this in an instant. And British Columbians don't trust this Premier's radical agenda. So again, to the Premier, will the Premier end the decrim deception today and scrap this disastrous so-called safe supply programs and the reckless decriminalization policies that continue to devastate communities across the province?
Premier.
Thank you, Honourable Speaker. We made a commitment to British Columbians to do a couple things. One is to do all we could to help ensure their loved ones had a chance of surviving, had a chance to get into treatment, opening more treatment beds, more detox, finding ways for them to connect with services, trying to remove some of the stigma around drug use so that they could talk with family and friends about dealing with addiction. We got a lot of construction workers get injured on the job, they're dealing with pain with opioids, things get out of hand, and they find themselves addicted to pain medications that are increasingly dangerous for them, for example. How do we encourage and find spaces for those folks to come forward and deal with those addictions? These are serious issues. This is not a simple challenge for us. Alberta's grappling with this, Saskatchewan, both of them setting records for deaths. All of us trying to find ways to move forward here. The chiefs of police stood with us on Friday, supporting this approach, just like they stood with us at the beginning of this process, trying to find ways to ensure that we're not using the criminal law to respond to what is basically a health issue. And I hope that we can continue to work together as a province to deal with this public health crisis in ways that respect the dignity of the human beings struggling with addiction, but also in ways that ensure that our communities are safe for everybody.
Leader of the Official Opposition, second supplemental.
Thank you, Mr. Speaker. Well, Mr. Speaker, the problem in large part is that the government's really good at making announcements. But when people need treatment, they need it available when they want the treatment. An announcement doesn't help. And I think it's notable, Mr. Speaker, that nowhere else in the country is anyone following these disastrous policies. In fact, in Oregon, they quite wisely said this was a disaster, and they rolled back the entire decriminalization experiment. Now, this decrim deception guarantees one thing for sure. One thing we know for sure, Mr. Speaker. There will be continued chaos in our hospitals, in our streets, and right across every community. Nothing is going to change from Friday's announcement. Nothing is going to change as a result of this Premier's announcement on Friday unless and until this catastrophic decriminalization policy is entirely dismantled. Just this morning, this NDP government blocked for a second time BC United Opposition's attempt to debate and vote on fully repealing this failed decriminalization policy. So again, to the Premier, will the Premier today just acknowledge the massive mistake that was made, acknowledge the chaos that exists in virtually every community in this province, and scrap this failed decriminalization experiment?
Premier.
Thank you, Honourable Speaker. The announcement on Friday was an important one. It was an important one and a significant one. Police stood with us because they understand the significance of what we're asking the federal government to do and the change that it will make in terms of giving them the tools that they need to ensure safe communities for everybody. The member talks about his concern about ensuring treatment beds, but I'll remind the member of his record. Cut $35 million in supports for mental health and addictions for youth. Closed Riverview without community supports in place. That was 2012. Ordered health authorities to make $360 million in cuts, which resulted in cuts to the Atlas Youth Recovery Centre in Terrace. Closed the only withdrawal management program in the Fraser Valley. Cut funding for 22 residential care beds in Surrey. Now, I understand the member wants to resolve from that record. That is his record. And it's equally true that all members in this House stood, including the members of the Conservative Party, and voted for the All-Party Committee on Health that recommended this approach. So we're going to address the issues in community. We're going to support people struggling with addiction, opening 200 treatment beds this year alone, including 16 treatment beds at Orcolalum, just up in the North Island. We're going to continue to do the work, and I hope that all British Columbians work together to address this public health crisis.
Member for Surrey South.
Thank you, Honourable Speaker. Well, the Premier wants to speak about records. Here's his record. 15 months of the decriminalization pilot and the most deadly overdose year in British Columbia's history. Under this NDP Premier's decrim deception, dangerous and harmful drug use continues unchecked. Instead of addressing severe addiction and untreated mental illness with effective care, this government squanders taxpayer dollars on policies that perpetuate, not solve addiction. My question, Mr. Speaker, is why won't the Premier scrap his disastrous, unwitnessed so-called safe supply program and decriminalization policies, give police the tools they need to compel people into services, and actually help people who are addicted get better?
Minister of Mental Health and Addictions.
Thank you very much, Honourable Speaker, and thank you to the member for the question. And I think, one thing that we certainly agree on is that the toxic drug crisis is indeed taking a devastating toll on communities, across British Columbia, across the country. And we are working to try every single thing that we can do, to try every tool that we can to turn the dial on that crisis. And Honourable Speaker, when it comes to the work that we do with law enforcement and with municipalities and public health, we've been responsive. We've done We've worked with them to be responsive to the issues that they've raised, and that's really what Friday was all about. But let me say to you, Honourable Speaker, there has never been an investment in mental health and substance use service, care and supports than what our government has done in the last 5 years. There simply hasn't. There simply hasn't. You know, a government, when they were on this side of the House, that deregulated, privatized the entire supportive recovery sector. We are working to rebuild those supports. We're working with that community, with community partners, with our health authorities. 600 beds over the last number of years, 200 this year alone, $117 million to support those community providers who are providing those important services to improve the care, to help them stabilize. We are investing in upstream supports. Honourable Speaker, we have to do everything that we can together to deal with the toxic drug crisis. That's the work we're going to continue to do.
Surrey South supplemental.
Honourable Speaker, this minister has talked about being responsive to police. But in fact, it was before this pilot even began that police warned this government of the consequences of law enforcement being handcuffed and unable to respond to the unintended consequences that they caused. And the Premier's decrim deception just shifts the burden of the crisis that he caused onto law enforcement without equipping them to compel intervention and treatment. His plea to the federal government directs police not to detain or compel individuals to court, but merely to move them along to nowhere, ensuring failure. The Premier must scrap the decriminalization pilot, empower police with legal authority, and expand real solutions like drug treatment courts to compel people into life-saving services. So my question to the Premier, what are police
Members, please continue.
Thank you, Speaker. My question to the Premier is, what are the police expected to do? What are they expected to do when there are no services or mechanisms to compel people to the help they desperately need?
Minister of Public Safety and Solicitor General.
Thank you, Honourable Chair, and I appreciate the question from the member. The changes that were made, Honourable Speaker, were done in consultation, working with local governments and working with police themselves, Honourable Speaker. Police who understand that this is a medical issue, not a criminal one. These are the changes that were put in place, changes that police themselves asked for, that they said they needed. That's what we announced on Friday. And, Honourable Speaker, we will work with police on the solutions that they need every single time. You know what it comes down to, Honourable Speaker, and what I find particularly concerning, is the only deception that is taking place is we hear from the Leader of the Opposition to scrap decriminalisation, and then we hear from other members of the Opposition who stand in committee stage, not in this chamber, Honourable Speaker, during estimates, and they say things such as, the NDP will try to tell you that we're backtracking on decrim, which is not the case. We're not backtracking on decrim. We're backtracking on the need for, we're not backtracking on the need for harm reduction. Does it mean that our party doesn't support decrim or harm reduction? Absolutely not. We do. With our whole hearts, we want to save people, Honourable Speaker. We get one thing from the Leader of the Opposition and another thing from other members on that side of the House, Honourable Speaker. That's the only deception taking place.
Leader of the third party.
Thank you, Honourable Speaker. People are facing long healthcare wait times, struggling to secure family doctors, having critical services cut, and BC's most vulnerable keep slipping through the cracks. I heard from a constituent just this morning that her mammogram was cancelled because there weren't enough nurses at the hospital. In budget estimates, I asked the Health Minister how many workers are on the front lines of our healthcare system compared to the number in administrative or corporate roles. He told me that BC has, quote, one of the lowest administrative costs in Canada. Data from the Canadian Institute for Health Information tells a different story. Of the provinces, BC is tied with Saskatchewan for the second highest percent of the entire healthcare budget going to administrative costs at 2%. The provincial average across Canada is 1.87%. My question is to the Minister of Health. As Minister, he has added over $200 million to administrative spending. Can he point to any improvements to healthcare that have come from this increase in administrative spending?
Minister of Health.
Well, thank you, Honourable Speaker. Overwhelmingly, what we're doing is adding frontline workers. The member refers to primary care. After our new payment model with family doctors, we added 708 new doctors, net new doctors, in 9 months, Honourable Speaker. We had the record year for hiring new nurses, record year for hiring new health sciences professionals. Our HCAP program, which delivers frontline care and long-term care and in hospitals and home support, is one of the most successful health human resources programs in history. The Canadian Institute for Health Information does review these questions. They say we have the 3rd lowest administrative costs in Canada. That's what the numbers say, Honourable Speaker. And they show that the percentage of administrative costs in British Columbia has been reduced as a share of the budget since I became Minister of Health.
Leader of the Third Party Supplemental.
Thank you, Honourable Speaker. I was reviewing the data this morning. Canadian Institute of Health Information comparing data across provinces right up to 2023. Since 2020, yearly increases in BC's administrative spending have been 11%, 9%, 15%, and 8%. I'm not sure which data the minister is referring to, but I'm looking at table D3 of the Canadian Institute of Health Information. Healthcare professionals report frustration with the growing burden of administration in the healthcare system. My question is to the Minister of Health. Does the minister believe that primary care in BC should be trusted to health professionals, or does he think that there needs to be ever more bureaucracy?
Minister of Health.
Honourable Speaker, since 2017, we've added 32 new urgent and primary care centres, direct services for people, added 1,800 FTEs to primary care networks. There's 77 of them across BC delivering services everywhere. That's doctors, that's nurses, that's nurse practitioners, that's allied health workers, Honourable Speaker. It is true, Honourable Speaker, that we have repatriated jobs in healthcare, and I am proud of that, Honourable Speaker. I am proud of that. People who worked in contracted positions before, who would work a lifetime in public health care without a pension, Honourable Speaker. They've been repatriated back to the public health care system. Honourable Speaker, this is about frontline workers everywhere. That's why we're leading in doctors, leading Canada in registered nurses, leading Canada in health sciences professionals, Honourable Speaker. And we had the best record, Honourable Speaker, the best record by our healthcare professionals and the people of BC in addressing the COVID-19 pandemic.
House Leader of the Fourth Party.
Thank you very much, Mr. Speaker. Last week, Conservatives asked this Premier to listen to the people of British Columbia and axe his failed decriminalization policy. British Columbians are glad that the NDP finally listened to common-sense Conservatives. While there's only 2 of us in this legislature, Mr. Speaker, it's clear that the Conservatives are driving the political agenda in British Columbia.
Members, member has the floor. Please continue.
Today I'm going to ask this Premier a follow-up question. Will he admit, here and now, that his Safe Supply program is also a failure and that it has killed British Columbians like 14-year-old Camilla Sword from Port Coquitlam? Will the NDP Premier listen to common-sense Conservatives and axe his failed Safe Supply program? Yes or no?
Minister of Mental Health and Addictions.
Thank you very much, Honourable Speaker, and thank you to the member for the question. And of course, I think on behalf of all of us here, we express our condolences to Mr. Sword for the loss that his family and that community has experienced. And when it comes to, again, how we respond to an unprecedented public health emergency in which 2,546 British Columbians were killed last year, where we lost British Columbians tomorrow, we're losing them today, we're going to lose them tomorrow. Across this whole country, we are seeing increases in mortality due to an unprecedentedly toxic drug supply where the concentrations of fentanyl are off the charts, where we see contaminants that do vicious, vicious things to people's bodies, that frustrate the ability of our healthcare providers to treat people. In the midst of this crisis, this is a time for us all to come together and listen to what our health experts are telling us, listen to what the health professions are telling us their patients need. And that's what we're going to do. We're going to continue to do that, work with the doctors, the nurses, the outreach workers who are helping us to implement the policies that will help to turn the tide on the mortality rate that we are experiencing as a result of this toxic drug crisis.
House Leader of the Fourth Party, supplemental.
Thank you, Mr. Speaker. This morning, columnist Rob Shaw wrote, and I quote, "Imagine for a second if former NDP Premier Horgan tried to cancel the museum project with the kind of public performance EB gave on decrim," unquote.
Member, no names, please.
Mr. Speaker, most British Columbians can't imagine that. It's clear after 2 short years that this failing Premier doesn't hold a candle to Premier Horgan. He just is not cut from the same cloth, not even close. Mr. Speaker, my question to the Premier: will you apologize to British Columbians for what Rob Shaw called arrogance, and to the families of addicts for the dangerous experiment the NDP played with the lives of their loved ones?
Minister of Mental Health and Addictions.
Well, Honourable Speaker, I think actually what British Columbians find unimaginable is the loss that they experience time and time again. That's what I think British Columbians find unimaginable. The people that I speak to who have lost loved ones, who have lost members of their community, speak to just the unimaginable gaps that those losses leave in their community. And I just want to say a word about, about stigma and about how careful I would implore all of us to be in this House when we talk about how we move forward on one of the most vexing health issues that we have ever faced as a community, as a province, as a country. Because the way in which we talk about this issue can create stigma, and stigma is a barrier to people reaching out for help. And that is what we are all about on this side of the House, building up pathways to access to care and support for people who desperately need that help. If people need help, please reach out to helpstartshere.bc.ca, where you can find resources in your community.
Members, House Leader of the Official Opposition.
Mr. Speaker, for over a year, we've been warning that taxpayer-funded so-called safe supply drugs are being diverted and trafficked by organized crime in communities across British Columbia. In fact, it's so widespread in the city of Vancouver that police there report that half of the hydromorphone pills they seize are from this dangerous so-called safe supply, being diverted straight to street-level drug dealers. So my question to the Premier is this: when will the Premier adopt BC United's policy of ending his decrim deception and ending his disastrous policies of decriminalization and of taxpayer-funded so-called safe supply drugs?
Minister of Mental Health.
Thank you, Honourable Speaker. I'm not entirely sure which policy the member across the way is referring to, because they do tend to change from time to time. But I will say this. Again, we work very closely with law enforcement. Our law enforcement partners stood with us at the beginning, have been with us, frankly, all the way through, from the original declaration in 2016 of the public health emergency, all the way through. And, what they say time and time again, and what they said at the Federal Health Standing Committee, was that their primary concern is around the production and distribution of counterfeit Dilaudid. That is a real concern for them.
Member.
The production and distribution by organized crime by predatory individuals and organizations that prey on vulnerable people in our communities. That is their primary concern, the issue of counterfeit drugs that are made to look like pharmaceuticals, like real prescription medications. And so we'll continue to take our cue from the people on the ground, the people that we are working with, the law enforcement organizations, the public health organizations, our healthcare providers, with respect to the advice they give about how we deal with these issues. Thank you, Honourable Speaker.
Supplemental member?
Well, Mr. Speaker, perhaps the minister should go and actually read the police testimony that was made at this federal standing committee that she just cited, because they actually were very, very clear that they were talking about counterfeit pharmaceuticals, not Dilaudid. Exactly. Now, under this premier, taxpayer-funded drugs are consistently reaching drug dealers, and they're flooding our communities and even making their way into our schools. Yet every single time that we have raised these questions, these serious concerns, the premier again and again denied that there was even a problem. The Solicitor General would bluster and make excuses. The reality is this: the NDP taxpayer-funded so-called safe supply drugs are trafficked to our kids by organized crime, and they're fueling the death and the destruction that we see rampant in our communities across British Columbia. So how much longer do communities need to suffer before this premier adopts BC United's policy by ending his decrim deception and ending his disastrous policy of taxpayer-funded so-called safe supply drugs?
Minister.
Well, I mean, Honourable Speaker, the member's simply wrong. I mean, of course we take issues related to diversion of pharmaceutical medications seriously. Of course we do. Of course the doctors who prescribe those medications take that issue very seriously. Of course public health takes that issue very seriously. It's absurd to suggest that we don't in the context of this public health emergency. We have to be serious about this issue. We have to be serious about this, and in fact our health authorities, our health providers are very serious about this issue. They are on alert. They are watching for those issues. We are putting in place mechanisms to make sure that we're monitoring and appropriately addressing with incidents related to diversion where people are misusing their prescribed medications. But let's be clear here about what is killing British Columbians. What is killing British Columbians is a toxic drug supply that has outrageous amounts of fentanyl and other terrible contaminants that are creating terrible health conditions for people. That's what's killing British Columbians, Honourable Speaker, and these are all the issues that we need to continue to work with all of our partners, as we have been doing and as we will continue to do.
Prince George Valemount.
Well, the minister wants to talk about listening to police. Maybe she should talk to the police in Prince George and Campbell River, because police detachments have seized over 18,000 pills being diverted from this government's so-called safe supply. We have asked this question. We have highlighted police seizures over and over and over again in question period. Last year, we raised the evidence of diversion on platforms like Reddit, with photos showing mounds of white pills beside their original prescription bottles. And yet, astonishingly, 2 weeks ago, this premier claimed, and I quote, "This is the first time we've heard that data," end quote. How out of touch could he possibly be with the severe harms that are being caused by his taxpayer-funded drug crisis? So when will the premier do the right thing? When will he adopt BC United's policy to end his devious decrim deception and his experiment with taxpayer-funded drugs?
Well,
Minister.
Thank you, Honourable Chair. I appreciate the question from the member. And they like to use words like deception. They like to, sometimes talk about how they're concerned about saving lives. But more often than not, they seem about wanting to make sure that they're in step with the Conservative Party down there, Honourable Speaker. Because we hear the Leader of the Opposition stand up and say, end decrim. And I'll reinforce it again, Honourable Speaker. On March 3rd, 2023, the member for Surrey South said, I don't want to come across as not in favour because through the Select Standing Committee on Health, we have supported. The NDP will try to tell you that we are backtracking on decrim, which is not the case. We're not backing on decrim. We're not backing on the need for harm reduction. Let me just say that again, Honourable Speaker. They said we're not backing on the need for harm reduction, Honourable Speaker. The opposition cannot have it both ways. They are either in favour of saving lives, Honourable Speaker. They are either in favour of saving lives, Honourable Speaker, or they are more in favour of being in line with the BC Conservative Party down the way.
The bell ends the question period.